Okay, I'm Hope Rugo from the University of California, San Francisco, and anybody who's been on the forum knows me. So it's great to have everybody here again for our forum. And we generally have a break in the summer. This time we've been doing some forums trying to address some of the special issues that have come up with the COVID pandemic for our breast cancer patients, their families, and the Bay Area community at large. We we'll continue to do our more academic forums, and we just had a really interesting meeting at the European Society of Medical Oncology. So our next meeting will focus on some of the really very interesting updates from that virtual meeting, which we all attended in the middle of the night if you happen to live in California, but really very interesting data. So I think people will be excited to hear that. And then, of course, we have our virtual San Antonio in December. Big thanks to Melody Galu, who, of course, without her, we wouldn't have a forum. She's really been incredibly helpful in organizing the forum and setting everybody up, as well as our guest speakers. Tonight, we have a really special program, and I will encourage everybody to send us emails, tell us what you're interested in, suggest topics, and give us some feedback on what you think of our now virtual forum in the era of COVID, how we can make it better, what you liked, what you didn't like. So this evening's forum is making the most of the pandemic mindfulness in the time of COVID-19. I'm a big fan of mindfulness anytime, but it does seem as though in the era of COVID-19 and some of the special issues that our patients face with breast cancer, both early and late stage and treatment, that this is an incredibly important time to be addressing this topic. And we're very, very excited to have Dianne Shumay with us, who's the director of psycho-oncology at UCSF, and who has been working with us actually for many years now, and has done a lot of very interesting projects in terms of trying to improve the quality of life of our patients, both in the short and long term, to help with stress management and coping goal setting for your particular meetings that you're seeking. But I think managing mental health and practicing mindfulness during a situation like this has never been more important for any of us, really, in the world. We have a Q&A function, and if you look at the bottom of your screen, you'll see on the far right-hand side, at least for me, there's a Q&A. I'll have that open and we'll field questions during the time that everyone is talking. So definitely use that. There's also the chat function, but we really encourage you to use the Q&A function during our conversation. There'll be plenty of time to talk with our panelists. Dianne is joined by two of her colleagues, and I'll hand the podium over to Dianne to introduce her colleagues and talk a little bit more and start our evening program.
Thank you so much, Dr. Rugo. It's so great to be back at the forum. I have presented a few times over the years, and I know that it's been such a service really for the community that you've had this for so many years, and so glad to be here. I'm joined by a couple of specialists in mindfulness, two of my colleagues in psycho-oncology at UCSF, Dr. Neha Goyal and Dr. Jennifer Gregg. And split the time, try to cover this huge topic of mindfulness, but really want this to be a conversation. We'd love to hear any questions that you have, any issues that you'd like us to address as we go through this presentation. And we have some slides to show you, and we have a whole bunch of resources for you. And we also want to spend some time actually doing mindfulness, because talking about mindfulness is one thing, but what is mindfulness and what does it feel like? And we all need a little mindfulness, you know, especially during Zoom calls. So, so glad you joined us. I'm going to go ahead and share my screen, and I'm going to go ahead and start talking first, and then I'm going to turn over the podium, as it were, to my colleagues, and then we'll wrap it up with some resources at the end. So like I said, we'll have a conversation and really talk and get into the meat, I think, of mindfulness. So let me share my screen. And hopefully you can see some slides.
Yep, we can see him.
And I'm going to go into a slideshow here. And as Dr. Rugo was saying, it is really an incredible time that we're living in with COVID. And it certainly has really put, I think, mental health on the map, so to speak. And, you know, we're all kind of, you know, not just folks with cancer, but folks who have challenges, all of us with this new normal that we have. So I did a little bit of introductions, but I want to just let you know kind of what we're going to be talking about today. I'm going to do a little introduction about mindfulness. Dr. Goyle will talk us through just really briefly mindfulness and science and what we know from research. And then Dr. Greg, who's really a world-renowned expert in this topic, is going to talk to us about mindfulness and values-based living and how you use mindfulness actually to live the life that's really worth living. And then we're gonna wrap up with a really lovely collection of resources that we have and some suggestions for how you can get more mindful, get trained in mindfulness, and so on. So I'm going to start with just a quick mindfulness practice, if you're willing. And you can do this with your eyes open. You can do this with your eyes closed. But it gives us a chance really to kind of settle in and say, what is mindfulness? I mean, before I tell you what the definition is, why don't we do it a little bit? So, so first start with just noticing where you are. Maybe you're sitting in a chair, maybe you're lying down, maybe you're walking and just listening to the audio, but just notice where you are right now. And you can do that with your eyes open. So as you stop and notice what you can see. So kind of look around and notice what you can see in this moment right now. And maybe even kind of count like 5 things you can see. And kind of pay extra attention to colors that you might be able to see. So notice what you can see. And if you want to, you can close your eyes. And you don't have to, but if you want to, you can go ahead and close your eyes. And behind your eyes, you might be able to see something like bright lights or colors. I think that's kind of interesting. When we close our eyes, there's something to see, even with our eyes closed. So notice that. And now with your eyes closed or open, your choice, notice what you can hear. Or maybe even notice that if your eyes are closed, you hear differently than if your eyes are open. But be curious about what you can hear right now. Do you hear any sounds? I'm assuming you hear my voice. Do you hear anything else? So what can you hear? And now what I'd like you to do is kind of notice your body. Notice where you are. Are you sitting? Are you in contact with a chair? Are your feet dangling? Are they propped up? Is your back supported? Is it not supported? And usually at this time when we start to notice our body, it's kind of the time we start wiggling around, which is fine. Just notice the urge to wiggle or notice the urge to shift positions. But as you notice those things, notice the pressure on different parts of your body as you're sitting and or lying or standing or walking, whatever you're doing. Notice the pressure. And then notice the absence of pressure on certain parts of your body. And take a scan down as you notice that. And then notice the temperature on your skin. And notice if you're breathing. Notice your facial expression. Notice if you're smiling. And now what I'd like to ask you to do is smile for a moment. Just smile and notice what that feels like to smile. It might feel odd. It might feel silly. It might make you feel a little giddy. But just notice as you do just a smile. And take a slow breath in. Smile and breathe. And notice the sensation that you have when you smile and breathe. Notice anything, whatever it is that's happening, notice it. And next time as you smile and breathe in, this time exhale and just imagine the air flowing down from the top of your head through your body and out your arms and fingers and your legs and toes. So we can do that again. That was a lot. So you smile and breathe in, and then you exhale and you just imagine this air just flowing right down your body from the top of your head all the way down and out your fingers and toes. And we can do that again. That's not too much. We can smile, breathe in, and just exhale and imagine relaxation just flowing down with the air. Just let your body just kind of relax and accept and allow. And if you want to do it one more time, smiling, breathing in, and just exhaling and just letting the air flow down through your whole body. And when you're ready, you can kind of open your eyes and focus back on what we're talking about here. And just kind of think about sort of what did you notice in that process? What was that like? And one thing that you can do with this very, very brief mindfulness / relaxation moment is that you can do this really anywhere, anytime. You don't have to have your eyes closed. You can do it while you're on a Zoom call. Gosh knows we need that. And it's sort of a little mini mindfulness. And it starts with really being present with your 5 senses. And it's just a lovely, really kind of package you can take with you. And now that we're all nicely relaxed and feeling okay, I'll start to talk about some of the challenges that we have with COVID and cancer. So there have been a number of studies and panels and task forces talking about the challenges for cancer patients during COVID. People have been characterizing just how challenging it is. It's not your imagination if it's been very difficult. Scientists are here to tell you that it has been. So it has been really challenging. It really adds, I think, for our patients to this sense of anxiety around health that already cancer patients and survivors are already dealing with. And so it sort of adds that on top. And it also adds this kind of sense of vulnerability as people are being told that, you know, being more vulnerable to some of the more serious effects of COVID. And also some concern about access to care has been an issue for folks. And certainly all the same concerns that even people without cancer have had around finances, lifestyle changes, isolation, concern about family, children having to be on Zoom schools or, you know, at universities where there may be an outbreak, and concern overall for the entire community and the globe. And so our patients and all of you and all of us really are in this kind of very difficult time together. One thing that I've noticed, and I think Dr. Goyle and Dr. Gregg would probably agree with me, is that our cancer patients are a little bit more suited. I think you all who are cancer survivors, and you're a little bit more suited to deal with something like this because you've kind of already done the health anxiety piece. You've already looked kind of your own mortality in the face. And you know, for the rest of the folks in the community, this may be the first time they started to really worry about their health, whereas you've probably gained some pretty good strategies and can actually kind of advise other people. So one of the things I wanted to talk about, and I know this kind of isn't mindfulness, but it kind of is, and that is this idea that, that we're all superheroes. And I know, like, you probably want to throw something at me because I know cancer patients are often considered like heroes, and it doesn't feel like it resonates. There's this thing called imposter syndrome where people kind of tell you you're brave and they tell you you're strong, but you don't feel it. But this is a different kind of superhero. This is a superhero that is flawed. And if you think about all the superheroes in the history of superheroes, every one of them has been flawed. There's been some kind of sort of their origin story comes from this wounded place, and despite that, they end up having this kind of ability to do good, and the path to victory is challenging. This work comes from a colleague of ours, Janina Scarlett, who does a lot of work around helping people find the superhero story within all of us. And I just wanted to kind of set the tone a little bit to say, you know, this is one of those times in history where people can step up and really do some good. And we all really need to be superheroes for ourselves and for everyone else. So how do you do that? And I think one way is to imagine people in our lives who really are superheroes. And superheroes don't have to be warriors. They can be quiet people that just do really important things, who represent values and really attributes that we really aspire to and admire. So if you take a moment to just pause and think about somebody in your life, or somebody that you think of from public life or from history, who's been just a really powerful and good person, who can be kind of a mascot for you today, and to help you kind of think, how can I be the best I can be, even while I'm dealing with something just incredibly difficult. And we're going to talk about some superhero powers. So one of them is mindfulness, and very, very linked to mindfulness is this notion of compassion and self-compassion, and how you live your best values even when things are really difficult, and especially when things are really difficult, as superheroes do. So I'll start with just a little bit about compassion. I'm sure most people on this call have some acquaintance with this notion of you know, the ability to feel others' pain and the ease, you know, the wish to reduce it or ease it. There's also this notion of self-compassion, which is kind of, you know, the ability to notice in ourselves that we're in pain, and then the wish to support ourselves rather than sabotage ourselves or criticize ourselves. And I think that I like to present this notion of self-compassion right in the beginning when I'm working, especially with my cancer survivors, because there's so much that we kind of beat ourselves up in. And one of the things that we beat ourselves up in is that we're not doing emotional well-being good enough. And I want to say we're going to start with, you know, giving ourselves a break and giving ourselves some support as we do something that's just incredibly difficult. And this last point on the slide here is this part where, you know, a lot of people think that compassion and self-compassion means that we're just going to, you know, kind of not try very hard and just like goof off and slack. Sometimes it's a good idea to take bubble baths and eat marshmallows. I mean, sometimes it's a wonderful idea to do that. And then sometimes we want to just, the most compassionate thing to do is to say, come on, get up off the couch, get out there, you know, do some good, take a walk, or whatever we know is really a values-based choice for us. And so I just want to kind of help you to understand that little angle of self-compassion. And I like to think of it as like if we were a really good parent to ourselves, like one of those really, really, really awesome parents, we would both nurture ourselves with kindness, but also kind of give ourselves a kick in the butt once in a while. And not literally, but, you know, say, come on, get up, get going, make your bed, that sort of thing. So a little vote for self-compassion. And then moving on to mindfulness, just want to give a little definition, then I'm going to turn the slides over to my colleagues. But just, you know, sometimes people wonder, you know, what is mindfulness? What is it not? You know, there are a couple of definitions. You know, you may have noticed for yourself, kind of when we did the first mindfulness practice, you may have your own definition for mindfulness. This idea of paying attention to the present moment on purpose without judgment is a pretty standard definition that's used in the field. So, you know, and you can kind of unpack that a bit. Really important and very aligned with self-compassion is this idea of without judgment, this idea of accepting things as they are, of noticing sensations, thoughts, and experiences that come along without having to change them. And people ask, is mindfulness meditation? So people ask that all the time. And what is the difference? And what is mindfulness and what is meditation? There are a lot of people that can talk about this for probably a whole week. I'm just going to say this kind of, that not all meditation is mindfulness. So there are types of meditation that aren't mindfulness practices. And there's ways to be mindful that isn't really the definition of meditation. So if meditation is a formal practice that you do for a set period of time, for example, and you know, some people would argue that's not even a definition of meditation, but if it were, you know, we can do mindfulness outside of formal practices. And so it's sort of both and it's neither in a sense. And then a lot of people say to us, no, mindfulness is not for me. What if it's not? I mean, some people can't sit and do a very long mindfulness. They crawl up the wall. They just can't do it. Their mind just, you know, they just feel so antsy. Is there a way to do mindfulness or take aspects of mindfulness and benefit from them without practicing in the exactly in the traditional mindfulness meditation? So, so there are different ways, and I encourage you to explore these different ways of practicing mindfulness without it being sort of a formal practice of sitting and remaining mindful. In the resources that we'll talk about at the end, I have some ideas for how to practice mindfulness outside of meditation. And then I just want to end here, and then I'll pass it on to Dr. Goyle, but just to talk about the fight or flight or freeze reflex, and a bit of just setting the stage for how mindfulness might really help us, especially in the context of cancer, COVID, and any kind of stress that we're dealing with, is that we as mammals, as animals, as humans, we naturally react when we're under stress. We react instinctively, and sometimes those instincts are exactly what we need at the moment. We jump out of the street just in time to not get hit by a car, you know, but sometimes we find ourselves just kind of bouncing back and forth like a pinball in a pinball machine, where we're reacting and we're reacting and we're reacting. And we may not be making the best choices when we're in that kind of reactive mode. And it certainly can be very disorienting and chaotic. And so how can we use mindfulness then to pause and stop and assess the situation and choose a response instead of just kind of being thrown around in the pinball machine? And so I encourage you, if you're curious, and I'm sure many of you already use mindfulness, but just really kind of like think about and observe your own ability to kind of catch yourself in the pinball machine, and see if you can kind of pause and just take a moment to kind of assess this moment and then choose a response rather than a reaction. And I'm going to pause here and just check to see if maybe there are any questions or any moment. Maybe Dr. Rugo has a question. Anything we want to?
That was really interesting. And I think one of the questions that comes up is how people incorporate this into their lives, and how you do courses on this. Do you think this is something that people need to go and do a course about? How can they maintain this over time?
I think it's really great. I think when people take a course in mindfulness, there's a level of ability that comes with that. And in the resources, we'll talk about some of the courses that are there. We're actually, we piloted a mindfulness-based cancer recovery course this past spring that Psycho-Oncology co-sponsored. And that same course with Valeria, who's a wonderful facilitator, is going to be offered now this fall. So over this next several months, there's going to be 3 series of mindfulness-based cancer recovery. And it's a course that's designed by Linda Carlson, who's a professor in Canada. She took a standard mindfulness-based stress program, and she converted it to a cancer-focused one. And so it's really wonderful. And we had just really, really great satisfaction and response and happiness from this course that we offered in the spring. So we look forward to offering that for everyone this fall.
I think that's an incredibly important resource, and it's I think a nice example of how the Cancer Center is really tried to step up to the plate and deal with the pandemic and what's going on in our distance, distance experiences in general.
Yeah,
so
all,
really
all on Zoom, all on Zoom. And also,
I mean, you see a lot of our patients who are getting treatment. Do you feel like, I mean, this is something that seems like it can be lifelong. It's not, this is really hard when you're newly diagnosed with cancer, or you're struggling with advanced recurrent disease. But I think this is something that can help everybody at every stage, patients who are far out from their diagnoses. It seems like it would be applicable across a wide spectrum.
And I would invite my colleagues to chime in too, but absolutely. I think for like you said, Dr. Rugo, you as well can benefit from it. And so it's one of those universal kind of life skills that I think helps us to be the best we can be. And I think we can move on to share the screen again, and we'll invite Dr. Goyle to continue.
Yeah, I mean, I will say that medical oncologists either learn this or they don't generally continue on. I think they learn mindfulness, important part of what we do.
Yeah, and I'll actually add to what Dr. Shumay was saying about, and what Dr. Rugo was saying, is that this can be sort of, it's universal in the sense that it can be really helpful for many people. And I think that one of the myths that often, and Dr. Shumay alluded to this, one of the myths is like, you need to set aside 45 minutes of your day to kind of just like sit down and have this like quiet space and do this, long kind of practice. And I hope with the earlier practice that Dr. Shumay did with us, which I was very grateful for, because I still get really nervous when I know I'm speaking to a group. And so to have that ability to settle down today was really good for me. But it can be something so brief and so short, and doesn't have to be this really like intensive thing. And so that's one thing I've really appreciated, and I think is again applicable to everyone, regardless of sort of, you know, how much is going on in your life and how busy things may be and how, you know, how stressful things may be. So I have the pleasure sort of to briefly talk about some of the science behind mindfulness. And I'm going to be quite brief about it, because you could, again, talk about this for a week and have a whole conference about sort of all the research that's been done. But I bet if I talk to many people, you know, and ask them what mindfulness was about 20 or 30 years ago, many people would have never heard the term, let alone sort of been able to define it or even have tried it or practiced it. So within the last, you know, couple of decades, there's been a lot of growing research about sort of how, what mindfulness is, but also what are the potential benefits of that. And with that, there's been a lot, Dr. Shumay mentioned Linda Carlson, who's this professor in Canada, who's extensively studied mindfulness in the context of those who have cancer. And so one of the most consistent results that come from these studies is that there are absolutely beneficial kind of psychological effects from participating in doing mindfulness meditations and going through one of these courses that, that we're lucky to be able to offer here at UCSF. So the studies find that, you know, patients report less stress, less depressive symptoms, less anxiety. So across the board, sort of these really good psychological benefits that can come from practicing mindfulness.
Next.
Yeah, sorry, next slide. But what's also been interesting is they've also looked at some of the secondary benefits of it. So I think primarily we know, you know, that for many people there's the psychological benefits, but for our patients, I think a lot of what we as psychologists within psycho-oncology are also looking at is how can we use behavioral strategies or sort of non-medication based strategies to manage some of the side effects that come up from treatment. And so some of the studies have also demonstrated that for those who practice mindfulness or, you know, go through this mindfulness course, also report sort of some improvements in sleep, even improvements in fatigue, which is, you know, a very common side effect or symptom that I know my patients are often dealing with, as well as, you know, decrease in pain, which has been, you know, a wonderful outcome as well. There's a lot of initial sort of preliminary studies. So I want to give the caveat that there hasn't been a ton of data in this, and then any benefit that has been found has been very small. So this is an area of ongoing research. But some of the preliminary studies are sort of also demonstrating that, that going through one of these mindfulness courses can also lead to some improved immune sort of health, as well as sort of a decrease in what's called cellular aging. So there's this thing on your, they're called telomere lengths, and that the mindfulness courses have shown that they can have benefit on these particular sort of biological effects. So again, I want to be clear that those are very preliminary and that there's not necessarily sort of robust evidence for it. But these are definitely some of the reasons why, you know, as a evidence-based practitioner when it comes to psychology, one of the reasons why me and my colleagues, you know, are often telling our patients about mindfulness, encouraging them to find ways to incorporate this into their life. Next slide. I think now I'm going to pass it on to our colleague, Dr. Greg.
I'm just going to throw in one question that came up and before Dr. Greg starts about a question that came up about when will the cancer mindfulness class take place? Is it geared to breast cancer or cancer in general? Many of us will need even more support with the election and winter.
We will share the link and the information. I believe that the first series is recruiting just now. They just announced it. If you get the newsletter from the Patient Family Support Center at UCSF, it will be listed in there, but we'll make sure that we share the link for that information. But yeah, I think it's a good time. It's not focused on breast cancer, it's all cancer. It's open to folks, whether you're getting treatment at UCSF or you're getting treatment somewhere else, and it'll be online, on Zoom.
Actually, before Dr. Greg goes, we had, I forgot that I was going to do a small mindfulness as well to have a little bit of an experiential. So to give a little break from all the talking, we'll do another sort of brief mindfulness. So the one that I chose to do is, it overlaps with the one Dr. Shumay did, but it's just going to be a brief body scan. So for those of you who decide to sign up for this course, one of the main sort of mindfulness meditations that you may do is a body scan. And so I'm gonna lead us through a really brief one just to kind of, again, give ourselves a break. So again, if you feel comfortable, you can sort of close your eyes if that feels comfortable and safe to you. If not, I suggest that you just leave your eyes open and have a soft gaze of something that's just a couple of feet ahead of you. And just start off by noticing your body wherever it is, whether it's seated in a chair or lying down. Just feeling the weight of your body wherever it's making contact. Just take a few deep breaths. And as you take these breaths, bring in more oxygen, enlivening the body. And as you exhale, have a sense of relaxing more deeply. You can notice your feet on the floor. Notice the sensations, the weight and pressure, any vibration or heat. Notice either your back against the chair or back against wherever you're laying. Now bring your attention into your stomach area and just noticing whether your stomach feels tight or tense or whether it's relaxed. Just continuing to breathe as you notice. Then gently taking your attention to your hands and your arms. Again, just noticing, no need to change what you're experiencing, just noticing any tension or softness. Now slowly bringing your attention up and noticing your neck and your throat area. Again, noticing, is this where you're holding any tension or tightness? Noticing any urge to change that. And now bringing your attention upwards to your face, to your jaw and your cheeks and your eyes, noticing where you may hold any tension. Noticing where you might be holding some of your stress. Again, there's no need to change it. The exercise is just to notice. And then note noticing your whole body as a whole. Just being present with yourself wherever you are, seated, lying down, noticing yourself as a whole. And again, focusing on taking a breath. And then whenever you feel ready, if you've got your eyes closed, you can open them up again. On to you, Dr. Greg.
Well, oh, that was just lovely. Thank you. That was really amazing. So my part of this discussion tonight is, I was going to say, after Dr. Goyle talked about the sort of scientific...
Jennifer, I'm sorry to interrupt. You're a little quiet.
Oh, let me be louder. Hold on. I have a headset, but I just don't like to wear it. But let me put it on. But in the meantime, I'll talk a little louder. So I was going to say that my job is to really sort of, if Dr. Goyle's job was to describe the benefits in terms of the science and talk about this in terms of our heads, that my job was really to help us think about it in terms of our hearts. Although I think after that lovely mindfulness exercise that we just did, I don't think that's necessary. So my job is really actually to help us think about this in terms of behavior. Can you imagine how much this little USB port will not go in right now for some reason? Can you hear me okay?
Yeah, you're pretty good.
While I'm struggling with my computer.
Just speak up. Just speak up. All of us old people.
Okay, now can you hear me?
Yes, you're great.
Good. So, like whether you think about it as being in your heart or in your behavior, mindfulness matters not only because it lets us bring our shoulders down. Mindfulness matters because we know that when our minds and our body are in the same place, we get to behave in ways that are more meaningful. And sometimes it's a little bit easier for us to think about what that means if we think about the opposite. I find it's a little easier for patients to understand if I talk instead about what mindlessness is in terms of behavior. And so when we are mindless, when we are not, when we are on autopilot is another way we describe that, we are reactive. Maybe we're in a situation where something annoys us and we snap. If you have been locked in with your family, then you may have experienced this once or twice in the last 6 months. And if you are locked in without anybody, you also may have experienced it once or twice in the last 6 months. And so this reactivity is something that we do when we're not paying attention. And we do these automatic things over and over in our lives. We have a lot of habits that we quickly establish. It's just what human beings do. And we get locked in a groove in terms of how we respond to certain situations that maybe if we were more aware or we stopped to think about it, we wouldn't do that. So that's one of the things that happens when we're mindless. Another thing that happens when we're mindless behaviorally is that we act in ways that are from other people's values. Maybe your mom and dad's. I'm from a super small town on a little island in Alaska, and the values that I got growing up in that little small town on a little island in Alaska are, if I'm not paying attention, I do all kinds of kooky things because I have these inherited values that aren't necessarily mine. And when I'm on autopilot, they come out. You can ask my family. Another thing we do when we're not mindful is that we really avoid things that we don't want in the short term and seek things that we do want in the short term. And there's nothing wrong with that. But sometimes when we stop and look at our behavior and we want to change something, it's because we've been overly controlled by sort of the short-term consequences of something. And we've missed this larger, long-term consequence of how we want to be in our life. And that thinking about how we want to be in our life is really tricky to do when we're on autopilot. So again, it's harder sometimes to think about mindfulness and how it impacts our behavior, but it's sometimes a little bit easier to think about it in terms of what happens when we're really not aware. And I would say it's those things. Okay, Dianne, if you want to change. There we go. So the opposite then is also true, that part of how we orient our behavior to become more mindful. And I always tell my patients that thinking about your values is a little bit of a cheat for people who find that they have a hard time doing mindfulness meditation. If you are somebody, I mean, you're here, right? You're here on a Wednesday night listening to a talk about mindfulness, so you're probably interested in this topic. And maybe you're not somebody who considers yourself unable to do the sustained attention required for mindfulness meditation. But I always think of thinking about your values as this sort of quicker, like shortcut to some of those processes. When we sit down and meditate, we do so that we can have this more aligned experience in terms of how we show up in our lives. Yeah, it's great to have your shoulders come down, but the way more important part of being mindful for most people is how does it allow you to show up in your life in a way that's meaningful and powerful for you? And so here, in the context of COVID and perhaps isolation and perhaps, job insecurity and food insecurity and kids at home, or, all of the plus and adding the extra vulnerability that cancer patients and survivors experience anyways, when you take all of that in, mindfulness allows us this ability to notice those experiences as experiences we are having, and also so that we can move forward, so that we can do something different in our life and behave in a way. Cancer patients and cancer survivors have had these powerful experiences of helplessness where they don't, the level of vulnerability of being a patient is so huge that, people experience this profound helplessness. And what thinking about your values allows, in addition to allowing you to see it more mindfully, is this ability to have a piece that you have some control over. That ultimately there's all kinds of things we don't have control over, especially now in these days of COVID. And so one of the things that mindful awareness allows is this ability to have something that you have control over, no matter what is going on in the larger world, and no matter what is going on with the presidential election and the coronavirus and the smoke and the fires and all of the things that we've all been handling lately. And it allows us then to behave in ways that are really intentional. That's really what this is about. That it allows you to know what your intentions would be if you were to set them, and to have really intimate contact with them, and potentially to behave in ways that allow you to be non-reactive and more flexible in situations that are challenging. Like, there's a lot of boulders in the road for all of us, but particularly for cancer patients. And so when those boulders come along, it's our desire to try to figure out a solution so we don't have to notice that there's a boulder there, or to avoid the boulder, or to try not to think about the boulder. But another option with a little bit more mindfulness a little bit more attention to your values allows you to kind of, you know, move with the boulder there, because that's not the last boulder for any of us. Also allows us to be more present. And as I was saying before, like thinking about these longer term goals that may be floating out there just out of view because we're so focused on the short term positives in front of us. So let me break down what that actually means, because, you know, I could be saying values and you could be thinking all kinds of different things. So let me try to be a little bit more specific about what I mean. Dianne? Thank you. And what we mean by values, when we're talking about values in the context of mindfulness and in general, what we're really talking about is, who do you want to be? Who do you want to be in terms of this life as it is? Not in terms of a life that's different, that you can imagine, that you could create, or that didn't have any coronavirus or didn't have any cancer, but in this life. A few minutes ago, Dr. Shumay said, you know, imagine somebody that you admire and what kinds of characteristics they have. Like, what are those? And I always encourage people to think about it in terms of adjectives. So here, I won't do one more mindfulness meditation experiential practice because I'm a little nervous that people are going to fall asleep. So instead of that, why don't we do this? I want you to think about your adjectives that you would want to have. And we'll start with the level of adjectives. And hopefully by the time I get done yammering on, we're going to get to the level of like what happens in your day, in your life, in your intention setting and behavior. But definitely, like, if you think about your adjectives, and I want you to think of 5 that you aspire to be in this life. And that could be, you know, some people, when I ask this question, they say, well, I want to be loving and present. And actually, I'll tell you, I had a breast cancer patient I saw today who said, she said a really remarkable list. I think she might have been a psychologist in her last life. She had but she said things like loving, present, willing, aware. And maybe those aren't yours. Maybe yours are fun or silly or connected or, you know, hardworking or, you know, serious or all kinds of different things, right? So, but the goal here is to think about, if you had to just have 5, because that's how many you can put on one hand, like, what would they be for your 5? So you can write them down, or you can put them in the chat if you're feeling extra brave. If one of them is brave, you can put it in the chat. I will be brave and tell you mine. Mine would be thoughtful, connected, aware, fun today. Sometimes that one's not on there. And compassionate. And they change all the time, but those are my 5 right now. So think about what your 5 are. If you only get 5, I mean, obviously you can have as many as you want in real life, but if you have, the advantage to having 5 is that when you're stuck in a situation and you don't know what to do, you can try to remember your 5. And then we can expand it out, right, to what kind of partner do you want to be if you're a partner, or even if you're not a partner and you hope to be a partner someday? What kind of daughter, mom, sister, aunt, niece, cousin, grandparent, friend, coworker, right? Like person in line in front of the person in the grocery store. How do you want to show up in your relationships? So sometimes people will generate more from that. How do you want to be in terms of your own growth, right? This is something that is especially relevant right now as people have potentially more time on their hands. And they always wanted to learn French, or they always wanted to learn to sew or whatever. But like, what is it? What do you aspire to in terms of your own growth? An important one for our patients is, what do you aspire to in terms of your health that you have control over? So not, the answer doesn't get to be, anything about things you don't have control over, but there's a lot that you do have control over. Sometimes patients say, I want to make sure I nurture my body with good food and I move it regularly. Like, those are things that you have control over. We don't always do those things, but those are things you have control over. What do you want to be in terms of what contribution you make? For some people, helping other people, as Dr. Shumay mentioned earlier, helping other people is what matters for their life. Some people it's politics, some people it's volunteering with animals, or, right? Like, how do you want to impact the world? And what do you aspire to in terms of fun and lightness, especially during COVID? It's important that we think about how we want to be in a way that is also light, because there's a lot about living right now that is really hard. And so noticing the amazing positives and fun times in your life too is just as important, and creating them. And so what we often say is, how do you want to look back? Like, if you get to the end of this crazy year, how do you want to look back and see how you showed up to the last 3 months of it? Like, what would you want to see? Not necessarily what would you see, because nobody's going to pull this off completely. But what would you want to see? What would you aspire to? How would you want to move, even if it's teeny, teeny, tiny little steps? And it's often got to be teeny, teeny, tiny little steps. And one thing we find that's super important for women, and so if there are non-women, people who don't identify as women on the call, that's okay too. It may apply to you as well, but we definitely find this applies more for women, that it's important to know that when you're talking about your values, that the yardstick that you use is yours, is not the impact on other people, even if that's related to your values. That it's really about you checking in with yourself about what you aspire to and whether you are moving towards those things. So I'll give you an example. My partner likes our bed made, and I really could care less whether or not our bed is made. It's just not something that, it's like 87th on the list to me. Nobody sees our room. Nobody's coming in our house anyways right now. Like, we're just going to get right back in it. It never has bothered me whether it's made or not. And my partner really likes the bed made. That's just like his thing. And when I make my little list, I notice, especially when I'm thinking about what kind of partner I want to be, I often include the word thoughtful. It's just something that matters to me. And so if I am the last person out of the bed in the morning, I try to make the bed, but I don't make it for him. I make it so that I get to the end of the day and say, yay, I was thoughtful today. Yay me. Not because, like, he doesn't have to be grateful. He doesn't even really have to deserve it. Because I'm not doing it for him. I'm doing it because that's who I want to be. And I get vitality in my life by moving towards the things that matter to me, by having my mind and body line up in the same place at the same time, by thinking, you know what, this is who I want to be. This is how I want to show up. I'm not going to be on autopilot when I get out of the bed. I'm going to make the bed, move towards this version of me, and I'm the barometer, not him. Okay, I don't know if there are any other slides, if I wrote any other slides, but I think you can change. Oh, I did. Okay, so this is a lot of words, that is more words than you need to see. So let me just translate what it means. Like, we know that mindfulness leads to higher well-being. And we measure well-being in a whole bunch of different ways as psychologists. But we know that there's a strong relationship between mindfulness and this ability to notice your experience in a non-judging way and well-being. And we think that happens through a number of different sort of channels. And the ways that we think it happens is that people who are more aware tend to have a better idea of what their values are. So they know their vibe, they know who they want to be. They also can behave more flexibly in different situations. They can control their own reactivity, which is what self-regulation means. And they take some chances, they take some risks, they act in ways that are brave and bold in situations that are meaningful but might cause a little short-term anxiety. And so what we know from the research is that when people practice this mindfulness, and I think it's really important that we don't think of mindfulness as only happening when you're sitting really still. Like mindfulness is having your mind and your body in the same place, having awareness. If you sit really still frequently, you will have your mind and your body in the same place at the same time more often in your life. But it's not required, I don't think, in my opinion. But when you have more of these moments of mindfulness in your life, we know that those people who have that tend to be more self-fulfilled, more consistent, more aware of their personal values in their life. At least that's what the research shows us so far. And we know from all of the work with cancer patients that we've done for years and years and years, having people think about how they want to show up in their life in a way that's meaningful in this life with cancer today, like, making the bed today, going for a walk around the block today, making small, tiny little steps today to influence sort of how you do this at the end of the day, we know that makes a difference for allowing people to have some control over things in the face of having not a lot of control, especially in a time of COVID. So I think that's all I wanted to say. I think that gives us lots of time for lots and lots of questions.
Yes, that was really great. I really enjoyed that a lot, and I hope everybody else did too. There were some questions that came up about whether or not these mindfulness classes were free, and Dianne has sent a message responding to that to the chat, not the Q&A part, which I think is really helpful because everybody clearly sees that. And when the course begins, and also the phone number is on the chat group too, if you want to write that down. And I think that then you can go on a notification list or waiting list for the next ones as well, which is great. So I think that other questions, of course, are really welcome. And I know that you have an amazing group here who can answer some of your questions if you want to send questions through Q&A or chat. I hope that you found the exercises really helpful. Dianne may have a few others up her sleeve. And I know she has some summary information to talk about as well. We're kind of low on questions this time, but again, really encourage people to put questions in if they have them.
Yeah, I just wanted to take a moment to just kind of summarize the points that we made, answer any questions. And also I have some resources that we compiled that, Melody is posting on the website, or having the website webmaster post or webmistress post on the website.
Webmistress.
And those will be available to you. But I wanted to orient you to those if we do have time in a moment, but just to kind of summarize all of this wonderful information that my colleagues have shared with you, to just remind you.
A few questions, Dan, if you want to maybe answer some of those before you get to all of your summary. Up to you.
Great, let's do that.
So I'll read.
I accidentally just answered one as having been answered that.
You got it? Exactly what happened. Don't worry.
I should not be allowed to touch anything.
No, it's I'm used to this. Like, we've all done it. So this question was: there are times when a person is being treated poorly by another, and what your advice would be for mindfully addressing this.
I'll let Dr. Greg answer that one.
Yeah, I'll jump in. I mean, the answer really, it's annoying for me to say it depends, but it super depends on who you want to be. What I would say is when someone's treating you poorly, it depends on what your values are and how you want to show up to situations where people are treating you poorly. I mean, hopefully it's not the case that you value sort of, you know, taking something that doesn't feel right. But like, you know, maybe the thing that's going to give you the ability to pat yourself on the shoulder at the end of the day is if you say exactly what you need to be different and stand up and say, this is what I expect, and so this is what I need. And maybe the thing that's going to allow you to pat yourself on the shoulder at the end of the day is to say, is something wrong? Why would you treat, you know, like there's all different things that you might be extraordinarily proud of yourself in terms of how you respond. I would encourage you to respond if you feel like you're being treated poorly, but what that looks like might really depend on kind of what's going to make you the proudest later on. Like, and sometimes that's what we encourage people to ask themselves. Like, when you look back on this later, what are you going to be most proud to see that you did next?
So let me just ask you there's a few other questions here, which I think are interesting. If you do start a mindfulness practice, how long can you expect for it to take before you start seeing some benefits? So how patient do you actually have to be when you start something like this?
Do you want to answer that, Dr. Shumay?
Well, Dr. Goyle can speak from the research.
Right.
And I can speak from my own experience, which is like the moment I begin to engage in a mindfulness practice, I'm immediately getting a benefit. So it depends on what benefits we're talking about. And Dr. Goyle, you want to comment on that?
I would say that this is still a question that hasn't been answered by the research. I think that when, you know, people study the mindfulness, they decided it needed to be this many weeks of practice, which I think was about 6 to 8, you know, but I think that, but yeah, anecdotally or personally, I know that for me, it's pretty immediate in terms of some of the benefits, if not pretty quickly. That being said, I also say to have patience. You know, I think for some, the benefits don't necessarily come sort of immediately. And I think that we can get discouraged and say, okay, I haven't done enough, it's not helping. And I don't know if we've given it a fair shot yet either. And so I guess it depends. But the research is, you know, they usually will say 6 to 8 weeks of practice is where they'll study in terms of how long it takes.
That's really good. And I think that's incredibly helpful for people to hear, because it seems like a lot of that is true of medications we use and a lot of things we do, that if you do one time, it doesn't work very well, except for things that are bad for you, like drinking alcohol. So.
Right.
I think that's a really good point. So sometimes people try things like mindfulness. It doesn't have some magic response, and then they say it doesn't work for me. So I often tell, just like you, Dr. Rugo, I'll tell somebody to kind of take it like a medication in a sense. Try it consistently for 30 days, and then we can have a conversation about whether there was some therapeutic benefit to it. So it's really similar to almost anything that you might prescribe, that by consistently using it for 30 days, you're gonna see at the end of that, and it's gonna be up to you to decide, is it something that I wanna incorporate in my life?
And then another really funny question was, and there's a few interesting more questions here, which are great, so keep them coming, is how can I be more mindful while listening to something on Zoom? Which is an interesting thing, I think.
I think it's challenging. I mean, what we know, there's a lot of data that say, you know, interacting over Zoom or online is much more fatiguing in lots of ways, because our brains we're not set up to do this as many hours a day as we're doing it right now.
I think that one of the questions is, you know, if you're trying to do your mindfulness, you know, because you've been on really, you know, on for a long time and meetings or whatever, you know, is that still okay? I guess it says the question is, I meant doing a body scan while listening to someone mindful. Is doing a body scan while listening to somebody mindful? I think you have to take that individually. I'll answer that one. I think that's you know, whatever helps you going through your experiences makes a big difference. So I think, being focused and being attentive is really helpful, but then you also need to focus on yourself as well and make sure, because I think sometimes taking time out helps you to focus a little bit more. There is another question, which is, I think my grown-up daughter runs into a lot, which is, how do you mindfully address people you interact with who are not wearing masks? For example, if you're running with a mask and another runner without a mask doesn't give you space, or for example, my daughter was standing in the Walgreens line and somebody had her mask, pulled down to here, right? And was talking and was right up against her. And she said, trying to be really nice, can you take a step back? And the woman was really nasty back. So it was just really hard. And then she started talking really loudly. So then of course my daughter turned her back to her because she knows all the spray is coming up. So the question is, how do you address that in a mindful way that's as little threatening as possible?
I would say, I'd be curious what Dr. Shumay and Dr. Goyal would say, but I would say, having both compassion and a really clear line for yourself, and not having those two things be mutually exclusive. Like being able to say, I know this is so hard, and also this is not working for me, I'm going to step away from you. That those two things you could be super duper nice and also really clear on your limit.
Right.
Mm-hmm. And I think the mindfulness piece comes in that we often don't think about what our limit is, or, we think we either have to react or be nice.
Mm-hmm. I think that's a really great answer. Another attendee asked, what if you have a lot of compassion for other people, but you have a hard time finding compassion for yourself?
Really common concern that people have. Really common. It can be very, very difficult actually, once we start becoming aware of how we don't turn that same compassion on ourselves. And we're really, I think, socialized from being young to kind of put ourselves kind of last in a sense, and that it's fine to do kindness for others, but the kind of language we say to ourselves and kind of beating ourselves up verbally in our heads, scolding ourselves for things. I think we do that, and so it's really to start by really, I think Judy Long, who's one of our chaplains who works for the Mary Center, she just really said this so beautifully. And I took her definition and put it on the slide, and that is that the first step of having self-compassion is to notice the pain, when we treat ourselves without self-compassion, to first name that and notice it. And from there, we can take the next step to sort of turn that same kind of tenderness and care that we would give kind of like a kitten or a baby or a small child, to kind of turn that same nurturing onto ourselves.
I think that is beautifully said. I just would add one thing. One of the parts of the definition of self-compassion in terms of how it gets studied in the research and the literature, that I would add to what Dr. Shumay said is that what we call common humanity, which is this piece of anybody in my situation would be having this reaction. Like that piece sometimes, especially I think for our cancer patients, like noticing that you're having a reaction, and as Dr. Shumay said, I think importantly, noticing the pain of your own resistance to that, but then also adding like, oh, anybody in this situation would be having this reaction. Mm-hmm. There's sometimes just something that frees you up to have more compassion for yourself if you can notice that.
I'm actually going to add something to that as well. So the advantage of having three panelists, I guess. The other thing that I would add to that is often just simply asking yourself, what would I tell a friend in this situation? I think when we can take a third perspective on something, that really allows us, especially for someone who person who asked this question says they can have compassion for others, but sort of have difficulty with themselves. So sometimes just simply asking yourself, so if my friend were telling me this, if they were telling me this, what would I say to them? And then apply that to yourself, or try to sort of apply that to yourself. So that's what I would add as well.
That's
Well
really
said.
beautiful and nice answers, very helpful. Another person had asked this question in advance and said, can you offer a language about how we can help people understand what mindfulness is and how it can help them? Which I think is something that we all run into. I mean, we're trying to help our friends and families, and then potentially the people we work with and care for in a variety of ways. This particular person notes it's particularly important when I'm trying to explain things in Spanish and there isn't a good word for mindfulness.
Right.
So I think,
yeah. So
is this a lot of touchy-feely, tingly stuff,
Yes.
Yes.
So Catherine, I would say, the first thing I want to say is that thank you for that question. We actually have a source of Spanish language free mindfulness programs. I don't have it at the tip of my finger right now, but if you reach out, perhaps we can share that with you. So there's certainly folks who've talked about mindfulness in Spanish. That might be sort of an easier kind of in for you, rather than translating my words. But there are some just fantastic Spanish resources. Valeria Galeto, who's going to be teaching the MBCR, is a Spanish speaker. And so she may be somebody that if you have the chance to take the course, you'd certainly at the end of that course be able to talk about mindfulness from a very expert position, and potentially in Spanish. So I'm gonna suggest that we share maybe those Spanish resources, maybe through Melody on the forum website.
That's great. I really appreciate that. Excellent response. I think one question which I think happens, a lot of people talk about is that how can you be mindful when you're fighting a brutal disease and you're very aware what your outcome might be? The question is, how do you incorporate that? And I found that to be even more challenging for my patients than it always has been with COVID, when they can't do anything.
Right. I'll take a swing, and then if one of my fellow panelists wants to. I would say it is scarier to be aware when something scary is in the room with you. But it's not safer to be not aware when something scary is in the room with you. And so, in some ways, what we want with mindfulness, more awareness, and slightly more connected, meaningful actions that mindfulness can bring about, is that you are focused on how you show up in your life on this day. And obviously that is so much easier for us to say. But if you can be focused on how you show up in your life on this day, then you get to have some awareness of what is often the case, which is today, in this day, I am actually safe. I am in a battle for sure, and I don't want to minimize that. But what Dr. Shumay was saying about kind of living in this fight, flight, or freeze is that the battle most of the time is relatively conceptual, not in terms of the side effects of the treatment and the scary moments in the treatment, but in the day-to-day experience of it. We are often safe here. And so what mindfulness gives you is the ability to check in, say, am I warm, dry, fed, cared for, watered right now? Am I safe? And that is harder to do if you are not aware.
That's just an excellent answer. So I don't know if I can add much beyond what Dr. Craig said.
Somebody asked a really interesting thing, which is I've heard that we're practicing a mindfulness exercise during the middle of the day can help manage cortisol levels in the moment and later in the day. Do you agree? And if so, how much time do you think we should set aside for ourselves to practice in the middle of the day?
There are some data. Sorry, I just keep jumping in. Go ahead, Dr. Shumay or Dr. Coyle.
No, go ahead.
There are some data. I've done a study that is with cortisol with breast cancer patients. So there are some data that consistent mindfulness practice can influence the curve of your mindfulness over the course of the day.
Yeah.
I'm sorry, the curve of your cortisol over the course of the day, and that may have some longer term health benefits. The data aren't on giant groups of people, so it's tentative to say those types of statements. But you know, the reality is most of that work has been done with people who stay in a pretty mindful state most of the time, which for most of us isn't, you know, it can't be the goal. So the answer to the question of how much mindfulness would I have to do, I think my answer is like all of it. You'd have to do a lot to have that outcome necessarily. But the piece that we want to keep reiterating is your life, your ability to take care of your health in lots of different ways, and your ability to live in really meaningful life in the life that you have, it depends on sort of being aware in it. And so if you can, as Dr. Shumay was saying, you know, try this out 30 minutes a day or however many minutes a day for 30 days and see if it changes the quality of your life, that's going to probably be a better way to influence your overall health than trying to get at this kind of slippery thing we found in the research with the cortisol.
Other comments on that? Biochemical markers of well-being always seemed a little slippery slope to me too, but I don't know. And I also think that, you know, sometimes during the day you might not have the opportunity to do that. So you just have to be sure to take that time, either the beginning or end of the day also, to really relax, I think, and try and focus on the mindfulness approach. I think we've answered, actually. I really appreciated most of the questions. There's somebody did mention, Miranda, that I find practicing mindfulness before I take my blood pressure helps me have a lower blood pressure. So she thinks it does help. And there's definitely stories on that. And, you know, mindfulness could be as much as a Buddhist monk sitting in the cold, you know, the freezing cold in their skimpy clothes. So there's
Dr. Rugo, I want to just bring up the resources and just remind people that they're going to be on the forum website. So I'm going to share my screen real quick and just show you what some of those resources are. And
do your conclusion, because now I was just going to send it back to you. We have 1 more minute. So let me have you go ahead with your conclusions. And thank you very much for everybody's
yes. So
questions.
It's been a great audience, wonderful questions, a lot of interest. And I just want to show you, there's you can see my screen. There's a series of resources here, including a lecture by Dr. Carlson. She came last January and she was able to share a summary and an intro to her program, which is the one that's going to be offered October 15th at UCSF. There's a bunch of audio recordings that you can listen to and use. You can of course pay for meditation apps. And so there's just a bunch here, a lot of cancer and COVID options, different things. And then here's some advice that I give about meditating or not meditating, but using mindfulness in your life. So being mindful in your routine, turn something boring into a chance to be mindful, be fully present in the pleasant. So it's just some tips for mindfully brushing your teeth or mindfully watching a Zoom call, for example. And then there's this lovely poem called On Meditating by Mary Oliver. And maybe I could just read this and we could kind of round out the rest of this program with this poem. So it's called On Meditating, Sort of, by Mary Oliver. Meditation, so I've heard, is best accomplished if you entertain a certain strict posture. Frankly, I prefer just to lounge under a tree. So why should I think I could ever be successful? Some days I fall asleep or land in that even better place, half asleep. where the world, spring, summer, autumn, winter, flies through my mind in its hearty ascent and its uncompromising descent. So I just lie like that while distance and time reveal their true attitudes. They never heard of me and never will or ever need to. Of course, I wake up finally thinking how wonderful to be who I am, made out of earth and water, my own thoughts, my own fingerprints, all that glorious, temporary stuff. Mary Oliver.
Thanks, that was so wonderful. What a great way to end. So I'm sure that people have other thoughts. You have the contact information for the courses this fall. You have the resources that are posted on the forum website that Dianne and her colleagues very nicely provided. We also have some just lovely comments to briefly mention from the chat, which I think people may be able to see, but one of our patients commented that Dr. Goyle had helped her tremendously during her treatment, which is really exciting. And then again, a mention of a UCSF breast cancer patient who attends Healing with Writing, wrote and e-published a book on Amazon, From Cancer to Coronavirus, Evidence-Based Strategies from a Cancer Survivor to Thrive Through the COVID-19 Pandemic. And that's sort of an interesting thing too that was sent out. I figured it was worthwhile to just mention to everyone. I really appreciate Dianne, Jennifer, and Naya tremendously the time you've taken and volunteered to spend for our patients, their families, for Bay Area breast cancer patients and others to provide this resource. It's important for everybody to know that we tape this so it's available. Maybe Melody, you can briefly comment on how people can access that, the taping of this evening in case you want to refer this on to someone else who wasn't able to attend. We also look forward to seeing you at our next forum. We have a lot of exciting information to cover where I'll have guests who will help us cover some of that new data, which is rapidly changing our care. So I look forward to seeing you then too. And maybe Melody, you can comment on when that is as well.
Hi, yeah, our next forum is going to be on November 18th. And if you go to our website, I put it in our chat there, but our website is cancer.ucsf.edu/forum. You can find our past forums and especially the video ones. The last forum was on exercise in the time of COVID. So I think a lot of you would benefit from that also. But we'll let you guys know what our next topic is, but stay tuned. And if you're not on our listserv, email us and we'll get you on there.
Yeah, of course, our next forum will be focused a lot on ESMO update, the European Society of Medical Oncology. So wonderful program, deeply appreciated from one of our listeners. Thank you, this was awesome. I'll use these techniques myself and with my work colleagues. I appreciate your time and exercise, wonderful. And again, the same for me, wonderful. And thank you very, very much for participating. And thank you, Melody. Take care, everyone. Good night.
Good night, everybody.
Good night, everybody.